Yes, Dr. Najib, time's up. If you can start.
Okay. Hello,
Hello, doctor.
I'm Dr. Najib Mohiddin, one of the doctors working in this hospital today. Can I please
Yes,
take your
doctor.
name and
I
age,
know, I
please?
know who you are. Yes, please help me, doctor, because I injured myself from that patient of HIV, doctor, while trying to take a blood sample. Please help me. I am really very anxious and I don't know what to do.
Yes, I'm here to help you. Please be assured that I'm going to help you with all through the way. Please don't be scared. Let's talk it through. Is it okay?
Sure, doctor.
So, before we start our conversation, I would like to confirm your name and age.
Yes, doctor. This is Miss Sarah. My age is 24, doctor. I am one of the nurses who's working in the ER.
Nice to meet you. So,
Likewise, doctor.
yes, you have expressed a very valid concern, and that you had got a needle prick from an HIV positive patient. Is that right?
Yes, doctor.
Yeah. So this is a very common scenario that happens in the NHS. Please don't be worried. Let's just talk it through. So let's talk
Yes,
about the
doctor. So,
incident. Would that be okay?
do you think I'm going to get the infection?
It's not so, Ms. Sarah. There's a lot of factors that go into this before you develop any infection. So it's not that you had a pinprick, then you will develop an infection. So we're going to do some tests. But before that, can I ask you some questions?
Yeah, please, doctor.
So are you vaccinated?
Against HIV, I don't think there is a vaccination for HIV, doctor.
You're right. But there are other infections that can spread through blood. So I was wondering whether you've been vaccinated with hepatitis B virus.
Yes, doctor.
All right. Okay. And when you were drawing blood, were you wearing any gloves?
Yes, doctor.
All right. And how many gloves were you wearing?
I was wearing a single glove, doctor.
All right. Okay. And you said that you had a prick. So can you tell me about the needle? Was it a wide bore needle or a small bore? Can you tell me?
It's a small needle, the usual needle we use it for blood collection, doctor.
All right. Okay. And and the cut that you had, was it deep or superficial?
It was around zero point 0.5 centimeters, doctor, the depth of the injury.
Okay. And did it penetrate your skin?
Yes, doctor.
Okay. And did blood come out?
Yes, doctor. I saw blood in the needle.
Okay. And did you see blood on your hands or your fingers where we had the prick?
Yes, doctor.
And did you what did you do after that?
I tried to squeeze and rub the site of the injury, doctor, and I washed aggressively with soap and water.
All right. Okay. Well, Ms. Sarah, I'm here to help you. So we since you had a prick, so what we would like to do is we would like to run some HIV test. Would that be okay?
Okay. So when are you going to do it, doctor?
So we're going to do it as soon as possible. We're going to take a blood now and the
But
sample
doctor,
again after
why
6 months.
doing it now? Because I am aware that it will take time for the test to become positive. Is that correct?
You are absolutely right, Ms. Sarah, and I appreciate your knowledge regarding this. But we need to show whether you have the virus or will have the virus with you uh, currently or not, because we
I
don't
don't
know
have
your
it,
current
doctor.
status.
I don't have
Yes,
it.
you're absolutely right, Ms. Sarah, and I believe you. But we need to have a baseline test just to ensure that we are on the correct path and we know what we are how we are going to treat you.
Okay, doctor.
Does this sound okay to you?
Yes, doctor.
Okay. So it's going to be it's going to be a blood test, as you know, and it will be the reports will be very confidential. We're going to give it to you in our next meeting. It will not be provided to you over phone or email. Okay?
Okay, doctor.
And while we are doing this test, we are also going to check for other viruses as well, because hepatitis B and hepatitis C, as you know, may transfer by blood as well.
Okay.
Okay?
Sure, doctor. No problem.
All right. Okay. So can I tell you about the tests, the possible results of the tests and what we are going to do for you?
Yeah, sure, please, doctor. So, doctor, do you think that I'm going to get the infection?
It's
What
not like
risks?
that, Ms. Sarah. I do not think that you may get the infection. There's a very small chance that you may get an infection, and the percentage is very low. I can assure you that. However, I do not know the exact percentage, but I can tell you that the chance of transferring through a needle stick is very low.
Okay, doctor.
Okay. So what we are going to do is now we're going to form a multidisciplinary team with a bug specialist. And what we're going to do is before... Yes? Are you... do you want to ask me something?
Yeah. No, doctor. Continue, please.
Okay. So we're from a multidisciplinary team with a bug specialist. And what we're going to do is before the test results come out, since you had a needle prick, we are going to start you... we may start you on some medications which will be decided by the multidisciplinary team. Okay?
You mean HIV medications?
Yeah, some medications, so that there's less chance of you contracting the disease if the viruses transmit through the...
No, doctor.
Through the needle
No,
prick.
please. I will never take these medicines, doctor.
Why is that so, Ms. Sarah?
I would rather take my chances, doctor. You already mentioned that the risk is very low, right? So I would rather prefer to take my chances because I am pregnant, doctor, and I'm afraid that this medicine might affect the baby.
Oh, yeah, Ms. Sarah, congratulations for your pregnancy. And
thank you, doctor.
Yeah, well, there are some medications that can affect the baby. However, there are other medications which can be safely given to you so that the baby does not get any harm.
Okay. So is it safe during pregnancy, you mean?
Not
because
all the
I'm
medications, but there is one
safe,
medication sorry?
Because, doctor, I am aware that I have read that HIV medications might harm the baby. So are you sure that it is not harmful during pregnancy?
You're absolutely right, Ms. Sarah, that there are most of the medications are harmful for the baby, but there are some medications, there are a lot of medications for HIV, and there are a select few, which is not harmful for the baby, less harmful for the baby, or rather not harmful for the baby.
Okay, doctor.
Yeah?
2 minutes remaining. Yes.
So what we're going to do is, upon decision of the multidisciplinary team, we're going to start you on these medications. All right? And if the test results come positive, I'm very sorry to say, then we're going to repeat the test as well after 6 months. And however, but we are going to start you on the the correct medications to eradicate the virus if it comes positive. Okay.
Okay, doctor.
And if it's negative, then we're going to repeat the test again after 6 months just to be sure. Okay.
Okay, doctor.
Now, I need to give you some special advices since you have been in contact with the needle stick injury. Would that be okay? Can I tell you?
Yeah, please, doctor.
So I would advise you to tell your senior staff nurse about the incident that has happened, so that she can transfer you to a position where you do not need to be in direct contact with any patient.
Oh, goodness, doctor. Do you think I need to stop my job?
No, absolutely not, Ms. Sarah. You not to stop your job. Rather, we're going to shift you in a job that is not required you to be in direct contact with the patient. There are other jobs as available in the hospital where you do not need to be in direct contact. How does that sound?
I don't want to change my job position, doctor. I love my job.
I absolutely understand that, Ms. Sarah, but this is something we need to think of the safety of the patients as well. So I'm very sorry, but you need to inform that to your senior staff nurse, sir.
Okay, doctor.
And also, I would like to advise you that do you have any partner with you?
Time up. Okay, very well done, Dr. Najib. You did very nice. Okay, I believe that you were about to advise the patient to practice, I mean the staff nurse to practice safe sex, right?
Yeah, safe sex, and also to keep her brushes and razors separate if she has a partner.
However, you need to be a little bit quicker, because if the
Yes.
time did not allow you to go, they will deduct marks out of your clinical judgment. Okay, so try to be quick, especially that this nurse at the beginning during the introduction, she said, "Yes, doctor, I know who you are because both of you are working in the same hospital, right?" So you can skip the lengthy introduction. Usually, when I enter inside, this is for other colleagues who might be just starting their preparation journey. So when you enter inside, you will introduce yourself, right? And you will confirm the patient identity. And then you will tell the patient, or you will tell the surrogate why you are here. Okay, so hello there. My name is Dr. Tahir, one of the medical doctors in the clinic today, or in the hospital today, or in the medical ward today, depending on your position from outside. Okay, and then I will confirm the surrogate identity. Is it Miss Sarah? Yes, doctor. So, Ms. Sarah, we are here to discuss some issues related to your health. Is that okay? I will tell her why we are here. So, identify yourself to the patient, confirm the patient identity, and then agree the meeting agenda. And when identifying yourself, you need to identify yourself using both your name and your role. Your name and your role. However, you need to avoid jargon. Avoid jargon. Don't tell her, I am one of the doctors in the hematology clinic today. Immediately, you will find that the examiner is commenting within skill C that you used medical jargon. Okay, so avoid medical jargon. Okay, I am one of the medical doctors in the clinic today is enough, by the way. If you want to use the name of the exact clinic, try to avoid jargon. I am one of the medical doctors in blood clinic or heart clinic. Okay, but don't use medical jargon like cardiologist, gastroenterologist, hematologist. All of them are regarded as medical jargon. Okay, so use your third name, which is usually written in your card. We give you a card in the exam day. Okay, usually it will be the third name or the family name. So use that name. Don't use your first name. Okay, and then avoid medical jargon, as we said, and then confirm the patient identity. His name is enough. No need to confirm the patient by name and age. It is not necessary. Most of the time, it is not necessary. However, let us assume that I am breaking a bad news. I am about to tell the patient that he has got cancer, for example. Here, the patient will pass through specific emotional stages until he reach the acceptance, until he accept this bad news. The first stage is denial. Denial. Doctor, are you sure that this is my result? Doctor, maybe you are confusing my name with someone else. Doctor, please, are you sure? So here, if you are trying to break a bad news, it's acceptable to check the patient identity using his name and his age. Okay. So are you Mr. John? Okay. Or you can tell him, please, may I confirm your name and age, please? May I confirm your name and age, please? He will tell you, Mr. John, and I am 48, for example. Okay. So when you break the bad news, if he passed through denial, if he told you, doctor, are you sure that this is my name? Maybe you are confusing me with someone else. You can tell him, yes, I'm afraid that I am very sure that this is your result because we double check your name and age and file number and so on. Okay, because you will be passing through denial and then anger. Why me, doctor? Why this happened to me? And then bargaining. He will start to bargain. Doctor, is this treatable? Which treatment are you going to give me? I am not going to die. Is that correct? He will start to bargain about the management plan. Okay, and then he will pass through depression. Okay, doctor, I wanted to get kids really badly, doctor. Now I'm not going to be able to have kids if I receive this chemotherapy. He will pass through depression. And then the final step is going to be acceptance. However, in general, you can confirm the patient identity only using his name. Is it Miss Sarah? Full stop. This is more than enough. No need for lengthy introduction because you have got only 8 minutes and then you have 2 minutes maybe to answer one of the patient's concern at the end of your consultation before you proceed to closure. Okay, so confirm the patient identity, introduce yourself, and then discuss the meeting agenda. I am here to discuss, for example, your test result. Have you got any other questions you would like to ask? Anything else you'd like to discuss? And then check his background. Before we start, could you please tell me to which extent do you know about your health condition? Just to make sure that we are on the same page. Before we start, please tell me, what do you know about your health status? And then stop speaking. Let him tell you what does he know. Because you don't want to give the patient new information, okay, while he is already having knowledge about it. Okay, immediately the examiner will comment that you did not check the patient background knowledge. Okay. Then after that, you'll ask about his eyes, idea, concern, expectations, idea, concern, expectations. Okay. So have you got any questions or concerns for me? Okay. Do you want to ask me anything? Have you got any particular worries? It is not necessary that you should ask multiple questions to search for the patient eyes. No, one or maximum 2 questions is enough. Don't waste your time. Okay. So have you got any concerns at all? Have you got any questions? Sometimes the patient will start speaking about his background. Doctor, I came to the hospital with headache, and then they did a scan for my head. The scan came back normal, and currently I feel okay. So here I'm not. He will finish his background, I mean, by a question. Okay, so currently I feel okay. I don't have headache, and the scan is normal. So please, doctor, can I go home? Here, this is his eyes. Don't ask extra questions. Okay, I am glad that you do not have headache now. This is how I will start. I am glad, I am happy to hear that you are improving and you do not have headache now. Okay, and then proceed with the consultation. However, if he finished his background with a question, then this is his eyes. Is this point clear? Are we clear so far?
Yes.
Okay.
Yes.
Yes, clear. But can I talk in medical jargon as it is a nurse in this scenario?
Yes, exactly. This is what I want to say. So in this scenario, there is 2 main difference within your introduction. Because she is a nurse and she is your colleague who's working with you in the same hospital. So most probably you met before. At the start, if she said, yes, doctor, I know who you are, skip the introduction. Already she said, I know who you are. No need to ask her again, what is your name? You can just confirm her name and then proceed with the consultation. Okay. The second difference is that if she use jargon, you can use the same jargon. Okay. However, you need to check for understanding with each and every information you give to her. Did you get this point? Is this point clear? Did you understand this? Okay. So because she is a nurse, or sometimes before also that 3/2023, they brought a scenario in which you will be explaining multiple sclerosis to a medical student. Here you can use jargon, you can mention percentages and so on. However, you need to check understanding. If he said, I do not understand, you can explain. Okay, however, it's acceptable to use medical jargon if you are discussing the issue with a medical professional. Okay.
Okay.
So, yeah. So in this scenario, when you face a patient with needle stick, stuck with needle stick, the approach is AAA. You remember for medical error scenarios, we used to use AAA approach to explain or to discuss medical error scenarios. Admit, apologize, and action, which are basically the components of duty of candor. Here again, you will use triple S, triple A, sorry, triple A. Assure, assess, advise. Assure, assess, advise. The first step is to assure your patient that the risk of contracting HIV is very minimal. What is the percentage actually? Any idea?
I think maybe 0.2% or
0.03.
0.3, I forgot.
0.03.
Exactly,
Or
exactly.
three.
0.3%, 0.3%, which is very low, right? For hepatitis C, it is 3%. For hepatitis B, it is 30. Actually, it is 20%. However, crudely, we say 30 to make it easy for you to remember. So 0.3, 3, and 30. 0.3 for HIV, 3 for hepatitis C, and 20 to 30 for hepatitis B. Okay? So the first step is to assure your patient. Dr. Najib, I hear you telling the surrogate that it depends on a lot of factors. Yes, it depends on some factors. However, we need to do some tests. This has nothing to do with the risk, right? You can simply assure the patient that the risk is minimal. This is the first step. Otherwise, she will become anxious and she will have mental block and she will not understand the plan of management. Okay? So
Okay.
please be calm or calm down. I assure you the risk of getting HIV from needle stick is very low. It is not necessary to mention the percentage, however, it is 0.3. Okay, so calm down, please, because if you panic, you will become anxious and you will have mental block. We need to know exactly what to do. What should be the next step? Don't worry, the risk is very low, and I am going to tell you exactly what we need to do in order to prevent the infection. So the first step is assure. The second step is assess. This part you have covered very nicely. I was really happy with your performance. Okay, so you should assess the patient, the staff, the injury, and precautions. Patient, staff, injury, precautions. Patient, staff, injury, precautions. So regarding the patient, he is known to have HIV, yes. However, is he on treatment or not? Maybe he is on treatment with undetectable viral load, right? So here, the risk is very, very low. Okay, so is the patient on treatment or not? And what was the cause of admission? If, for example, he was admitted because of Pneumocystis carinii pneumonia or GVC, the new name. So here, the risk is very high, because it is high, relatively high, because this patient might have CD4 count less than 200, right? And most probably he will have high viral load. So you need to know, is he on treatment and what was the cause of admission? This is regarding the patient. Regarding the staff, past medical history, drug history, vaccination history. Past medical history, drug history, vaccination history. What do you mean by past medical history? Is he known to have HIV or hepatitis C or B? Okay, because needle stick is associated with risk of all viral infections, right? Not only hepatitis, not only HIV. So, for example, if the patient, sorry, mute your mic, please. Okay. I will mute on. So, for example, if she is not vaccinated against hepatitis B, you will tell her that she should receive vaccination. Okay. So, past medical history for hepatitis B, for hepatitis C infection, or even HIV infection. Okay. And then, are you on any treatment? Are you on any treatment? Why treatment? Because of drug-drug interaction with retroviral medications, right? Because of drug-drug interaction. So past medical history, drug history, and then vaccination history. Did you receive vaccination for hepatitis B infection? Okay. So this is regarding the staff and the patient. Then regarding the injury, as Dr. Najib said, the size of the needle, was it small gauge or large gauge? Depth of the injury. Okay. Was the needle full of blood? Okay, did you see blood in your finger? Because if the injury is significant to the point that she bled, this is more likely to introduce the virus, right? Then the precautions. Okay, were you using gloves or were you wearing gloves? Ideally, she should use double gloves, right? She should use double gloves. So let us assume that the nurse mentioned wrong action. For example, she mentioned that, doctor, I was trying to squeeze and rub the site of the injury. Here you have to give her advice. You have to correct her misunderstanding. Actually, she should not squeeze the site of the injury, right? Why? Because if you squeeze the site of the needle stick, when you release, this squeezing will create a negative pressure. And when you release your finger, it will suck the blood inside. It will suck the virus inside. So you should not squeeze or rub the site of the injury. Actually, you should leave the injury to bleed freely under running water. Is this clear? And then after a few minutes, you can wash with soap and water. This is the correct procedure. If she mentioned any misunderstanding, if she mentioned any wrong action she did, you need to correct her. Okay, please. You should be wearing double gloves if the patient is suspected to have infection. Please do not squeeze the site of the injury. Please allow the wound to bleed freely under running water and so on. So regarding the precautions, were you wearing gloves or not? Yes, doctor, I was wearing double gloves, for example. Did you squeeze or rub the site of the injury? Or did you allow the injury to bleed freely under running water? Did you wash with soap and water? So when you finish assure, you will move to assess, and then you will move to advise. Advice regarding what? You have three main types of advice. Advice regarding her health. I mean, which treatment she will receive and the follow-up protocol and so on. And then advice regarding her job, and then advice regarding her social life. So job, health, job, social life. Health, job, social life. Okay? So I will start with the treatment and follow-up. So you will need to take medication for prophylaxis. You will need to take medications for prophylaxis. It is called antiretroviral prophylactic treatment. Antiretroviral prophylactic treatment. So I will speak to the infection control department to provide you with the treatment. Usually, the infection control department will provide the starting dose. Okay. Otherwise, if the injury, for example, happened at night or at the weekend, here, usually the senior staff in the emergency department, they will keep the first dose of antiretroviral prophylaxis in the emergency department. If you go now to the emergency and ask your senior staff, you should have the first dose of antiretroviral. Okay, this is the procedure in most of the hospitals. Okay, so I will speak to the infection control department to provide the treatment. So usually the treatment, by the way, is triple therapy. Triple therapy. They will give 2 NRTs plus protease inhibitor, nucleoside reverse transcriptase plus protease inhibitor. So by the way, zidovudine and lamivudine are safe during pregnancy. Zidovudine and lamivudine, nucleoside reverse transcriptase, both of them are safe during pregnancy. Zidovudine will cross the placenta and even provide protection for the baby. Protease inhibitors, ritonavir and nevirapine, both of them also are safe during pregnancy. However, let us assume I forget these medications. It is not really necessary, by the way, to mention the name of the medicine. Okay, you can simply tell her that the infection control department and your woman doctor, okay, will decide which treatment is best in your scenario. It is going to be safe during pregnancy. I assure you, it will be safe during pregnancy. Okay. So why we need the medicine? To provide protection. What if not taken? I need to tell her because she might refuse, by the way. If she refuses, you can tell her, I am really sorry to tell you that if you do not take the medicine, there is risk of contracting HIV, both for you and the baby. Both for you and the baby. Okay, so let us assume that the nurse sustained injury from a patient We don't know his status, and he refused to do the test. What are you going to do in such situation? We don't know his status, and he is refusing to get checked. What are you going to do?
I would still if he has a high risk of HIV, then I would advise her to take the
Excellent.
pre-exposure
Excellent.
prophylaxis.
Exactly. Here, if my patient is of high risk of having HIV, for example, a businessman with promiscuous activity, a lot of travel history, casual relationships, tattooing, piercing, okay? Here he is of high risk of having HIV, right? He's refusing the test. So I will advise the patient, or I will advise the nurse to take the prophylaxis anyway. Okay. For such patient of high risk, the patient is having high risk, and the nurse sustained injury. We tested the patient, and he tested negative. Still, by the way, it is better to take the prophylaxis. Why? Because there is a window period, right? Maybe he's in the window period. He has the infection, but still he did not develop seroconversion. So again, I will discuss the issue with the nurse. Okay, despite he is negative, however, he has high risk of having HIV. He has the following risk. He is having tattooing, nails, piercing. He has high risk of HIV, so I would advise you to take the prophylaxis. Then it is her call. It is her decision whether she wants to take it or not. Is this point clear?
Yes.
So far, regarding the treatment, I told her why we need the treatment and from where she will get the treatment. And if she is not accepting, I'm going to mention what if not taken. What if not? What if she doesn't take the treatment? So here there is risk both for you and for the baby. Then I will tell her in brief about the side effects of medicine. So sometimes it can cause skin rash, and sometimes it can cause or it can make you feel sick. Full stop. Just skin rash and sickness. Just to tell the examiner that I am discussing the side effect of the medicine. Full stop. So what is the ideal time for her to take the medicine or to start the medicine? Any idea?
As soon as possible
within 72
72
hours.
If the test is positive, start it.
Ideally, within
Within
the
72
first hour. Within the first hour. Ideally, within the first hour. Okay. So she will take triple therapy. Okay. So for how long she should take the medicine? For how long?
1 month.
28
Excellent.
days.
Excellent. Both of them are correct. 28 days, 1 month. Okay. So here you need to tell her about the follow-up. Okay. She will ask, our surrogate was asking, why should I do the test now, doctor? I am aware that the test will take time to become positive. So why do it now? Any idea how to address her concern?
Yes, because there is a new test. We can check the B antigen, 24 antigen.
B24 antigen.
Can appear directly.
Okay, this is fine. However, why to check now? Why not after 3 months to wait for the seroconversion? Why we need to do the test now?
Maybe she has
Maybe she
previous
is
HIV.
positive. Insurance company will not. If
For compensation,
she's-
basically, or mainly
To
for
know the-
compensation. We need to know your baseline in case you plan for compensation in the future. If you test positive, unfortunately, okay, then they will request baseline negative test to prove that this HIV was contracted by the needle itself, right? So basically, or mainly, it is for compensation. So we will do the test now as baseline. And then to repeat the test, by the way, after 6 months from completing the treatment. So basically, after 7 months from now, you will tell her you will take the treatment for 1 month. Okay. And then after 7 months from now, we will repeat the test again. Sometimes you will need to repeat the test like 3 to 4 months. After 3 to 4 months, because this is the period for seroconversion, 6 weeks up to 3 months, right? And then you can repeat it again after 6 months. Okay. Meanwhile, if you develop any skin rash, if you develop any sore throat, if you develop any lumps or bumps, if you develop any high body temperature, please come to the hospital for assessment. Why? Because this might be a sign of infection, seroconversion, right? Seroconversion. So I will tell her the treatment, why we need it, and what if not taken, the side effects, the follow-up protocol, and I will give her warning about seroconversion. This is regarding her health. Then I will move to her job. This nurse is anxious, and she will keep thinking about the possibility of contracting infection, especially that she is pregnant, right? So it is better to give her sick leave for today. Okay, please go off duty for today. I will help you speak to your direct supervisor to arrange for replacement. And then we will raise an incident report. We will raise an incident report. What is the benefit of the incident report in such situation? Why to raise an incident report? Any idea? What is the benefit? Why do we need to raise an incident report?
Because it is the usually preventable incident, to just make sure it will not happen again. Precautions about the incident.
Yeah. So as usual, all the incident, the main reason in all incident reports is quality improvement. Quality improvement. What do you mean by quality improvement? For example, this nurse tried to squeeze, right? Tried to squeeze the needle site, the injury site, and she was using single glove when the patient is known to have HIV. So obviously, she needs to get some refresher training or refresher session, for example. So the incident report, they will investigate why this happened, how this happened, and how to prevent this from happening again in the future. For example, they can arrange refresher course or training session for all the staff nurses about how to protect themselves from needle injury. For example, they have a technique. The name of this technique is single-handed technique. Never, while trying to cover the needle with the needle cap, never use both hands. Okay, use single hand. So you put the needle cap in the table, and then using your single hand, you will take the needle and then put it inside the cover. This will reduce the risk of injury. They will tell them, please do not squeeze and rub, because this will create a negative pressure, which will suck the virus in. So please allow the injury site to bleed freely and the running water. Please wear double gloves and so on. So training will help to prevent this from happening again in the future. Okay, this is why we need to raise an incident report. It is not to blame the staff or to punish her. So we will need to raise an incident report. I assure you, this is not to blame you. However, this is only for quality improvement. Okay, this is what are you going to tell her. So the first step, go off duty today. We will speak to your supervisor to arrange for replacement. We will raise an incident report. Okay. We are done with her job. So do you need to tell the patient, or do you need to tell this nurse, please stop doing nursing procedures?
I'll refer her to occupational health doctor.
This is a smart answer. Smart answer. Okay, because if you say this, you will escape from the concern. However, if you want the correct answer, no need. We need to understand that this patient now does not have HIV. If she has HIV, this is a separate issue. However, she sustained a needle injury, and we just mentioned, we told her that the risk is very minimal. Why do I need to stop her from doing her job? I know that some people might tell you stop her from doing her job. However, according to guidelines, this is not my personal opinion, by the way. It is not my personal opinion. According to guidelines, no need to refrain from procedures. No need to tell her stop your job or modify your job. She can continue her job normally, provided that she is using the standard precautions. She is wearing gloves like normal. Okay, no need to stop doing procedures, even bloody procedures. Unless two situations. Of course, during follow-up, if she tests positive, then you need to stop her from doing procedures. Or if she develops seroconversion illness. However, at this stage, no need to tell her stop doing procedures or modify your job. Or no, you will give her only sick leave for 1 day, for example, because she will not be mentally prepared for duty. She is anxious. She's thinking about the risk of infection. She's thinking about her baby. So better to go off duty for today. However, no need to stop her job. Is this point clear? I will tell you one more thing. Even if she tests positive, okay, and then she received treatment, and after receiving treatment, she cleared the virus. Her viral load is undetectable 2 times during the previous 12 months. Here she can go back to doing her job like normal. If she received treatment, cleared the virus, okay, and then tested negative twice, the viral load is undetectable. She can continue being nurse like normal. Even if she did not receive treatment, okay? However, she tested negative twice within the past 12 months. This is called elite controller. Elite controller. If someone got the infection, however, he tested negative, undetectable viral load twice the past 12 months, he can continue being a nurse or doctor, no problem. He will be on regular follow-up with the occupational health department, and he can continue doing his job like normal. Is this clear? So no need to stop her from job, okay? Clear?
Okay.
Okay, so we mentioned that advice
Hello,
is
sir.
going to be regarding, yes, tell me please.
Sir, I had a question. Sir,
Yeah.
instead of the patient being a nurse, if it would have been a surgical resident doctor, or if it would have been somebody who operates, then
Same.
we need to stop them from doing procedure, or shall we be the same?
Same. Bloody procedures.
Same.
It is called bloody procedures. Same guideline.
Okay. Okay, sir.
Okay. You need to
Yes, sir.
understand that this person has no HIV now. It is only needle stick. Okay. And the risk is very low. And this is the guideline. Okay. So advice regarding her treatment and follow-up is done. Advice regarding her job is done. What is left is advice regarding her social life. Basic blood transfusion or blood donation and sex. So are you married? Do you have partner or partners? Any casual relationships? Yes, but please tell your partner or partners and practice safe sex. Practice safe sex. Okay? During the periods until she tests negative. Okay? And then avoid blood donation. So she will need to practice safe sex meanwhile, okay? And she will need to avoid blood donation. However, regarding her job, she will need only to follow the standard precautions. Okay? After you finish her social life, you can move to closure. However, Dr. Najib, because you did not, the time did not allow you to speak about safe sex, blood donation, okay, go off duty, you did not speak about them, and also you modified the patient job. So here I believe they will deduct marks out of your skill E and skill C, because this is inaccurate information. It will affect skill C, and also it will affect skill E, which is the plan management. Okay, so you will get like let us say 12 to 13 out of 16. Okay, any question? Any question regarding this scenario?
Yes,
I
sir.
have
Should we take a consent from the patient for HIV?
Consent for HIV is verbal consent. You will need just to tell her that you need to do the test. Okay. However, the consent is verbal. Okay.
So we just
why?
say we need to do the test and she approves it.
Yeah, that's
Do I need to explain to the patient that you are a high risk injury? This is a high risk injury or low risk injury, or no need? For example, because she is pregnant or from the depths of the
okay.
from the depths
Okay.
or size of
Okay. So we mentioned that you will start with assure. You will assure her that there is no minimal, and then you will move to assess. Okay. Regarding whether the patient is, the person is pregnant or not, this is because of the medication, antiretroviral medication. If she is pregnant, you will select different type of medications. Safe during pregnancy. Okay. However, starting the consultation, I will assure her. Okay, and I will tell her that the risk is minimal. Okay.
Okay. Doctor, the patient in the scenario is telling she's pregnant. Any need to ask about which trimester and regarding involvement of woman doctor in mode of delivery like this or no need?
Which trimester is not necessary. However, within the management plan, you will tell her we will involve the woman doctor. The woman doctor and the infectious disease specialist or the infection control department, they will select a safe medication for you. It will be a safe medicine during pregnancy. There is safe medications during pregnancy.
Okay. So regarding mode of delivery, no need to explain more.
Mode of delivery is going to be C-section. Okay.
Yes.
Yes. However, I don't think it is really necessary at this stage. Okay, because it will be discussed by the woman doctor. Does it make sense?
Yeah, thank you.
However, if you mention also, if you have the time, you can mention. However, it will be discussed by the woman doctor. It will be enough if you involve the woman doctor. Maybe she will test negative, we don't know, right? So at this stage, I don't think it is wise to discuss the mode of delivery.
Okay, thank you.
Okay, so thank you for joining this session. See you next session, inshallah. And goodbye.
Thank you very much.
Thank you.
Thank you, sir.